Good afternoon and welcome to Mercy Health Muskegon's Healthcare Spotlight, where each week Mercy Health will bring you important information that helps you become more informed and involved in your healthcare decisions. We believe that carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. And I'm your host, Erin Patrick, Regional Manager of PR and Communications with Mercy Health Muskegon. And today we have the privilege of talking with some of the members of a team responsible for a unique scavenger hunt here in Muskegon. You may have just seen them on the news this week. With us, we have Dr. Jerry Evans, who is the Chief of Emergency Medicine for Mercy Health Muskegon. We have Dr. Amanda Payton, who is a fourth-year resident at Mercy Health, and Chad Lawton, who is one of the EMS coordinators for the West Michigan Regional Medical Consortium. Thank you so much for joining us, all of you. One of the things that I wanted to talk to you about today, first off, is the scavenger hunt. It is the kind of scavenger hunt that can and has saved lives. The West Michigan Regional Medical Consortium, along with Muskegon Central Dispatch 911, announced their quest to locate each and every AED, automatic external defibrillators, in our community. So Dr. Evans and Dr. Payton and Chad, please tell us how this initiative came about.
Thank you, Erin. This initiative came about as part of a project. As residents, we get a great opportunity to work with Chad and with Dr. Evans with the local EMS. And further discussion with them, we came up with a project that we could work on to help enhance their goals in improving the cardiac arrest survival in the local area. So with further discussion with them, we thought, and looking at what other EMS agencies and other counties have done, the idea of the AED Scavenger Hunt to help us locate all these AEDs so that when we have all the locations of the AED, we can place it in the 911 dispatch system. This would allow whenever somebody calls in with a cardiac arrest, the dispatcher would be alerted of where the closest AED would be so that they can that can be passed on to the bystanders who can go get the AED.
To me, it seems like something that would already be in place, but it's not, and it's not in every community. So I think that for us in Muskegon, it's definitely something that you don't know you need until you need it. So Chad, if you can talk to us a little bit more about what your role is at the consortium and how you're involved in this initiative.
Yeah, so one of the titles I go by is EMS Administrator from Muskegon County. That's my primary responsibility. So I help Dr. Evans as the medical director for EMS with oversight of the EMS system. So that's my primary responsibility. With that, we like to do a lot of quality improvement initiatives whenever possible. And one that we targeted about a few years back, I think in January 2014, was improving survival from out-of-hospital cardiac arrest. Primarily because traditionally the survival rates for that are very, very low. But if you examine certain pockets throughout the country, there are several communities that are experiencing significantly high survival rates compared to the national averages as well in comparison to ours. And there are several reasons that go behind that. Use of AED by bystanders is one of those major important components that helps to increase survival. So we've targeted that as one of our goals to help us improve survival from cardiac arrest, and we're very hopeful that this AED Scavenger Hunt will help us along that path.
Dr. Evans, you as the Chief of Emergency Medicine can probably talk to us about the impact that bystander AED resuscitation or shock can have on the survival rate. So how have you experienced that as your time here at Mercy Health?
Well, I think the important thing to remember is that all the things that we do in resuscitation, there's only two that are actually scientifically proven to make a huge difference in survival, and that is bystander CPR, or starting CPR very quickly, and AED use, so getting electricity to that patient. So cardiac arrest often happens, and most often happens, when there's an arrhythmia or a unusual rhythm in the heart. And that can be caused from many factors. Most often in the middle-aged and elderly population, what we're looking at is a problem with blockage of some of the vessels in the heart. Now, that is happening in younger and younger patients. We've seen people in their 30s and 40s having heart attacks because of that cause now. So, again, the only proven method of survival or mechanism of survival is going to be early CPR and early electrocardioversion with an AED. Now, our system is designed that we have firefighters throughout the region that are throughout our county that are all trained in CPR and have AEDs. But again, it takes a few minutes for those people to get there. It can take up to 10 minutes to get a firefighter there to do CPR. Now, we try to do that within 5 minutes, if at all possible. And in some parts of our community, that is possible, but not everywhere. So by the time a person goes unconscious and their heart stops, the faster you get CPR and an AED to that patient, the higher their chance of survival. And the numbers are pretty startling. If you look at somebody that has gone into cardiac arrest, if you can get them an AED within 10 minutes, then their chance of survival is only about 20%. But if you can get them an AED within 3 minutes, their chance of survival is over 50%.
So, I mean, that's a huge gap to fill.
It is, yes.
And I think businesses, if they, are hearing these statistics right now, and hopefully business owners are listening, that the investment in an AED, could mean life or death for some of their, most precious customers. So
absolutely, or staff.
Or staff, exactly. Right. So what is it since we're on the radio, we don't have visuals. Tell us what an AED looks like so maybe somebody can think about a point of reference where they have seen one before.
Yeah, so AEDs, they come in many shapes and sizes, but they all operate pretty much the same. They generally are, some kind of square box, maybe half foot by half foot in width and length. Usually they're posted on some kind of wall, usually by an entrance to a business, for example. They'll usually have some kind of signage that has maybe a picture of a heart with a electrical bolt going through it, and it says AED above that. Also should say AED on the AED itself. Many manufacturers of these things, there's really only two things you need to know when it comes to using an AED, though. They're really built for anybody to use, even if you don't have any experience. Number one, you need to know when to use it. So if you're in a situation where somebody is unresponsive and they don't appear to be breathing, that's when you're going to want to go ahead and start CPR. And you would use the AED in that situation as soon as it's available. So if you send somebody to go get the AED... You're doing CPR in the meantime. Correct. So you send somebody to go get the AED, you're doing CPR in the meantime. As soon as that AED gets back to you, you're going to want to go ahead and stop whatever you're doing and transition to using that AED. So that's the first thing you need to know is when to use it. The second thing you need to know is what's the first thing you do with the AED. And it's quite simple. You just press the on button. From there, AED stands for Automated External Defibrillator. So they're automated, and that's the nice thing about these is they're going to tell you step by step everything you need to do from there on. Well, and I think we have just a little bit of a sound clip here of an example of what an AED would sound like. So we're going to open up the AED and then wait for some directions, I think. So let's see.
Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pads. Okay, so that's just an example of, what maybe a certain manufacturer's AED directions might be when you start that device. So for all of you in the community that may be a little hesitant to jump in and help if you're in a situation where maybe a friend or a colleague or a coworker has a cardiac arrest and you're not sure, you don't want to mess anything up, these are built for that exact situations, under stress and probably undereducated necessarily about how to use something like this. So it walks you through step by step, even down to the detail of tearing open a foil package. So it's going to walk you through, and so you can feel rest assured that if you're at a location with an AED, that you can take that step and help whoever is in need. So how long have AEDs been around? Have these always been in businesses?
That's a good question, but they've been around 15 years or more, where AEDs have been around the communities. they are not as common as we would like to see them. All of our pre-hospital folks, our fire departments have AEDs. Some of our law enforcement has AEDs, but community members have not had them as much as we would like. Now, some of our stores have them. A lot of the department stores will have them. Some of the restaurants will have them. And a lot of schools have them. But again, it's not as common as we would like. And the other thing is just a little bit of training. Because if you have an AED, that's great. But if you don't know CPR, then that doesn't help as much. So we want people to be able to do CPR and have an AED. Now, that doesn't mean that you have to be scared that I'm not going to get an AED because I don't know CPR. CPR is very easy to learn, and we can do that. In fact, Dr. Payton is going to be doing a real emphasis on that coming in January and February, and we're always trying to teach people CPR around our communities.
So, Dr. Payton, what are you going to be hosting this winter? What is the awareness that you're trying to create with CPR?
So throughout the month of January and February, we plan to host several different bystander CPR events throughout the community to raise awareness and just train people on general bystander CPR. These will be free events. They'll be working with some of the local fire departments to help at different basketball games, but we certainly open it up to any group within your community, any church group, school group, anywhere where a group of people come together frequently. When somebody has a cardiac arrest or were to pass out and need help, it's going to be important that everybody, anybody local can start CPR. So like Dr. Evans said, it can be 5 to 10 minutes before we can get a fire department there. So you don't have to be a card-carrying BLS lifesaver to make a difference here. Anybody can do compressions and get an AED started and save a life of one of your friends or your family members. So we would like to certainly open that up to anybody that would like myself or anyone from the group to come and just teach bystander CPR. We've got a couple events planned, but I'll have the entire January and February, any time, day, weekend, evening available to come out and teach your group CPR.
And I know that we will help promote that through Mercy Health's website. So in the months coming up in the fall, we'll probably start promoting those winter dates. So stay tuned for that, www.mercyhealth.com. Dr. Evans, have you ever been in a situation where you have seen a patient present in the ER that has had their lives saved by either, CPR, compressions, AED, or both?
Yes, I have, and we've seen that happen frequently, and it's a wonderful thing when somebody survives out-of-hospital CPR. Now, unfortunately, we've had a lot of cases where CPR wasn't done until EMS arrived, and then those people sometimes do survive and sometimes don't. But the best chance of survival is for somebody to have bystander CPR. And one of the things that a lot of people were afraid of in the past is, I don't want to do mouth-to-mouth because I don't want to get some disease. Well, we don't teach that anymore. We're not doing mouth-to-mouth resuscitation anymore. Now it's compression-only CPR, which means all we're asking you to do is push on the chest. And that's an important factor because a lot of the community was afraid of doing mouth-to-mouth resuscitation in the past. So that has been eliminated from bystander CPR now. So I think that's a very important point.
Yeah, and if I can add on to that, I think another roadblock potentially was liability. People were scared that there was a liability if they injure somebody by pushing on the chest, maybe accidentally break a rib or something, that they're going to get in trouble, or if they don't do it right because they weren't trained or they don't remember how to, they were scared of that liability. And so that's really not the case, actually. There's really some strong laws out there in the state of Michigan that protect not only EMS, but it extends to the bystanders as well through Good Samaritan laws. And really, as long as you're not intentionally trying to harm somebody, you're really quite protected in a situation like that.
How do AEDs help doctors and nurses when, a patient presents? So, for example, I know you said they've saved the lives, but when they're passed off to you, how does it help you in the services that you provide to the patient after that?
Well, a lot of times in out-of-hospital cardiac arrest in adults and in teenagers, it's usually a malfunction of the electric system of the heart. So the heart kind of beats from the top. The electric system starts at the top and goes all the way down. When somebody suffers from a cardiac arrest, for whatever reason, that's been interrupted and it's kind of erratic. So the blood flow can't pump from the heart to the brain, and that's where people don't survive a cardiac arrest because they go for a period of time without getting oxygen to the brain. So the oxygen is still in the blood, it's just not getting anywhere. So by using an AED and shocking the heart, you kind of reset it. So you stop it and let the normal electric system start over again. And this is important because that needs to happen early. It needs to happen sooner. So when it happens in the field before they get to the hospital, that person has a much better chance of a meaningful recovery, or a recovery with brain function and the ability to act as they were before the event.
Okay. So we know now that AEDs are important. They're important for businesses to have. They're important for businesses to promote that they have this, and maybe make other business owners aware that, you know, this establishment has an AED. What is it, are they cost prohibitive? Is a business owner or someone who manages an establishment, how do they get one? How much do they cost? What's the process in order to obtain the device?
Yeah, so they can be somewhat cost prohibitive if you're looking and talking about dollars and cents, but I find it really difficult to compare that to the cost of someone's their life. Ranging anywhere from about $500 to $3,000. So there's really a broad spectrum of how much these things actually cost. There are grants out there that you can go after in certain circumstances to help pay or offset the entire cost of these. We do have recommendations if you contact our office as far as what AED we would recommend, and that's primarily based off of what AEDs are actually already out there in the community and out there in our EMS system, so we can kind of have good flow when our first responders and our EMS folks get on scene. But yeah, unfortunately, there is a cost to these things, but again, I find it hard to talk about because I don't like comparing the cost of somebody's life. And these things absolutely do make all the difference. Earlier, Dr. Evans mentioned some statistics, at the 5-minute and the 10-minute mark. Well, there's a new one out from the American Heart Association. They've actually found that if you administer an AED within the first minute of arrest, your chances of survival are 90%.
Wow.
Which is staggering. If you're talking about, comparing that to what our current survival rates are in Muskegon County, about 10.5%. Okay, so it just makes, I can't stress or emphasize how much these things make a difference.
That's an amazing statistic, and I just think it's probably one that will motivate those community establishments that maybe don't have an AED right now that need one. So I'm just going to bring this a little bit back in time to February of last year, when a patient of ours, Michael Thaler, had a cardiac arrest in a very popular establishment, Pigeon Hill Brewery, downtown Muskegon. It just so happened, by the grace of God, literally, that 3 of our off-duty nurses, Mercy Health nurses, just so happened to be there, dining at the time, and came over and did start compressions on Michael. But, they were looking for an AED at Pigeon Hill, and there was not one. And at the point in time that this was happening, some of the other businesses around downtown were closed. It was after business hours. And so someone had the thought of, gosh, maybe the Amazon apartment building has one. They're probably open, or maybe the LC Walker Arena has one. And so luckily this was a running club, that Michael was attending. And so a runner sprinted down to the LC Walker Arena and grabbed the AED and brought it back to the nurses, which then began using the device, and it did save his life. And so I want to lead into really why we're here today. I think that the scientific information that you all gave is going to be the motivator. But now I want to talk about why we're motivating people to become aware of AEDs, because we are on what is going to be an AED Scavenger Hunt for the next month. So August 1st through the 31st, you guys are going to be asking our community to do what?
So we will be inviting and asking the entire community, everybody, any group or individual, family. You can make a big event out of it. But anytime you find an AED, we will ask you to report the AED location, the address, where it is in the building, and a picture of it if you can. It's not essential. And we'll ask you to report these. You can get exactly where to report it and all the information on the website.
I think I've got it right here. So we have www.wmrmcc.org/AED-registry is where you can go. And we will post that on Mercy Health's website as well. But again, wmrmcc.org/AED-registry.
So when you register on the website, you'll register yourself either as a group or an individual. And then you'll get an email confirmation that will give you, again, the instructions where to upload the picture and where the AEDs were, as well as just a kind of confirmation page that we ask you to bring with you when you go around to the different businesses looking for these AEDs, just so you can show them kind of what you're doing and introduce the project to them as well, especially if they have any questions about why you're looking for an AED. But anytime you're out eating, anytime you're at church, just at a family event or out in the park, it would be very useful if you could just think of where around you think that you could find an AED, and if you can find one, then if you could report it. It's hard to know if somebody's already reported it or not, so if you just report it, and if there's duplicate applicants, that's okay. We can certainly sort through them.
And I think another cool aspect of this that I know that we're going to help with is just maybe highlighting some of these businesses on social media that already do have AEDs. So if you're out and about and you're taking a picture, post it to Facebook and say, hey, I found this through the AED Scavenger Hunt. You know, if next time you're out at a restaurant or you're at a baseball game or you're at the movies, try and find one. Send your kids to look for one. And if you find one, make sure to visit this website and register it.
And that's where you do, and that is one way to submit the AED that you found is on the West Michigan Regional Medical Control Facebook page. So then it would be easy for you to share and to show with your friends what we've got going on.
And what are we going to do once people are registering these AEDs? Where's that information going?
Yeah, so the goal here is we're working in collaboration, obviously, with Mercy Health, but also with Muskegon Central Dispatch 911. And what we're going to do with this information is help them to create a database. So we'll provide them this information, and then they'll go ahead and put it in their computer-aided dispatch system. So it's called a premise note, so that when a certain address is associated with a phone number that calls in, if there's an AED, it will pop up as a premise note to that telecommunicator, and they can go ahead and then give instructions back to the caller that there's an AED on location and where specifically in that building it is, in case, which is often the case, the caller doesn't know. So,
and then if there's not an AED, it will tell you where the nearest location that you can find one is, correct?
That is correct.
So if maybe a next door business has one, they'll be able to say, hey, the address next door has an AED and they should be open, so that much like what happened with Michael Thaler can also happen with another patient, to be so lucky.
I want to just emphasize what happened with Michael Thaler was so critical because bystanders started CPR right away. Mm-hmm. It took a few minutes to get the AED there, but that's okay because the CPR was in progress.
So they were doing compressions.
They were doing compressions immediately. Mm-hmm. That is so key. And this is what we're trying to do. This is not just an AED project. This is a out-of-hospital survival project. So that involves a lot of community members. We want people to know where the AEDs are, and that's critical. But we also want them to know how to do just compression-only CPR. And if they can do that, they can save a life. And that is so cool when you're involved in something like that. It's a remarkable event.
And I assume that when you've had an experience where you've helped save someone's life through CPR and or also using an AED, that your passion for that probably spreads like wildfire. And I think that's probably what we're looking to do in the community. So if somebody is interested in your upcoming sessions, or what if they want to get more information about becoming immediately trained in CPR, is there a place that they can go right now to talk to someone about maybe taking a class either now or with you later?
We have been in the business since we started this project back in 2014 of trying to do as much awareness, bystander awareness and training for free as we possibly can. And we've done a lot of that over the course of the last few years. We have several trained actually, or several scheduled rather for August coming up here. So August is actually going to be a really busy month for us. So if anybody ever is interested in anything like that, they can absolutely contact our office So my email direct is clawton, Lawton, at wmrmc.org. That's probably the quickest and easiest way to get the information to us, is just go ahead and email me direct, and we can go ahead and set something up for them. The larger the group, the better. We like to come out and train as many people as possible. So, I mean, we'll absolutely, do a training for our 50, 100 people, however many they want. But even if there's only a few people, we'll do that as well.
And what happens at the training? Are all participants able to practice on I don't want to say a mannequin, but some kind of, somewhat real life experience? Can you talk to us about what the training entails?
Yeah, absolutely. So we have different trainings that we'll do. We kind of try to figure out what the group wants and tailor that to their needs. So we can do a full-blown American Heart Association certification course, for example, or we can do just the simple hands-only CPR training, which takes about 30 minutes that Dr. Evans was talking about earlier. And we absolutely do have them practice the psychomotor skills on training aids. So, yeah, they would actually be getting down and learning how to do the actual compressions.
Does that training also include infant CPR? Because I do believe that's just a little bit different. I know that, I'm a mom of 3. I just came back from maternity leave not too long ago and have a 5-year gap in between this baby and my last. And so I haven't had training in infant CPR in a while, and I know that's important to a lot of moms here in the community. So do you have something specific for them that is offered as well?
We do. So again, we try to tailor it to whatever the group would like, but there's a difference between infant, child, and adult CPR. Not too much of a big difference from child to adult, but definitely for the infant. So yeah, we can do that if that's needed and wanted. Okay.
So if the community wants more information, you can visit www.wmrmcc.org /AED-registry. You can also visit WZZM.com, WZZM13.com, type in AED in the keyword search, and their story will actually come up, probably, I think, the first one, where you can see Dr. Evans and some of the other group members, as well as some community members who are all engaged in this initiative. There's also some incentives, I believe, in participating in this AED Scavenger Hunt. So why don't you tell us a little bit about what people can win as part of this cool effort?
Yeah, there's some great prizes out there for the winners. There's some prizes for the top people who find the top number of registries. The top prize is $300 for each the team and the individual who finds the most AEDs. There's also a second and a third prize down to $50. There will also be several random drawings for anyone, so even if you've only got one AED that you see, please report it, and you'll be entered in to win one of the random drawings, which includes some Pistons and Griffins signed memorabilia and tickets, as well as some gift cards.
Well, that's awesome. So I think that we've given you more than enough reasons to participate in this upcoming AED Scavenger Hunt with our group here. And I want to just thank you guys for coming in. Dr. Jerry Evans, who's Chief of Emergency Medicine, Mercy Health Muskegon. Chad Lawton, who is the Emergency Response Administrator for this group, WMRMCC, and Dr. Amanda Payton, who is helping also lead this effort. So thank you so much for coming in. We'll get you back on the radio here coming up in the winter to talk about those CPR classes. But in the meantime, please visit their website, their Facebook page, our website, and our Facebook for more information. Once again, I want to thank our listeners for tuning in today. We thank you for always joining us Saturdays on our program. Our broadcast has been brought to you by Mercy Health Muskegon. Visit our website for more information regarding your health and what we're doing to support our community. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's either or, it's all of this and more. It is Mercy Health.